The history of Bonne Terre and its hospital begins with St. Joseph Lead Company. The company was founded in 1865 and grew to become the largest lead mining operation in the world. By 1883, the company saw a need to expand its on-site infirmary into a hospital for its employees. In 1894, the hospital was moved to a new building on Allen Street in Bonne Terre. At the time, single employees paid 50 cents per month for the care and maintenance of the hospital, while employees who were married paid $1. This hospital served the company for 16 years, until St. Joe decided to expand the hospital again and open it to the entire community. They bought a large plot of land and built and equipped a new hospital at a cost of $75,000.
They purchased some acreage across from the Bonne Terre Lake and started building the hospital. This is still under St. Joe Lead Company. The hospital opened on July 23rd, 1911 at the location on Lake Drive, having been an infirmary at 2 other locations before that. So the third hospital building is actually the one that we think of as the original hospital building.
Bonne Terre Hospital became the first hospital in southeast Missouri, and for many years was the only hospital between St. Louis and Cape Girardeau. The hospital grounds were surrounded by a fence to keep stray cattle away. A large garden was planted to provide meals for employees and patients. Farm animals also provided a resource for food.
The Buildings and Grounds superintendent had asked permission to build a shed on the hospital grounds to house their cow, and they had a hog, and so they used all of these things to create meals for the patients. That's where their food came from.
Since the hospital now served the entire community and not just the employees of St. Joe Lead Company, they did have to charge for their services, but the rates were pretty reasonable.
In 1917, a private room was $14.50 per week. Major surgery was $10, minor surgery was only $5, and the superintendent of nurses' salary was $60 per month, and her duties were to purchase everything for the hospital, plan the meals, oversee the housekeeping, and she was in charge of all the hospital employees, and that was for $60 a month.
As the community grew, so did the hospital. In 1926, an extensive addition was built, nearly doubling the available patient space. By 1930, the hospital had grown to include 32 beds, a modern nursery with 5 bassinets, and an operating room that was a showcase of modern medical technology. The hospital was first accredited in 1946. And a second edition was built in 1950. There were 18 physicians on staff at the time.
If you were ill, you were sick, or you were having a baby, this is where you came.
Whether you were an employee, whether you were a citizen, whether you were a visitor or what, it was always a major factor in Bonne Terre.
It was a family-oriented place. The board of directors knew everybody, and you knew them. And the doctors really cared.
In 1951, Bill Gannott became the administrator of Bonne Terre Hospital. He would serve in this position for 23 years. During his tenure, the hospital experienced growth and transformation. In 1955, over 3,800 patients were admitted to the hospital. As the hospital became modernized, some of its long-standing rules slowly began to change.
There was buildings in the back of the hospital that were made into little rooms. Each nurse had their own room. That was a requirement. In the 1940s, nurses were not allowed to be married, and a couple of the nurses that worked for me during my tenure as director of nurses had worked in that era. And one particular nurse told me that she'd actually gotten married and had to keep it a secret for a year because she would literally be fired. She would lose her job if they found out she was married.
Even though times were changing, there was still one thing nurses were not allowed to do.
Nurses were not allowed to put catheters in males. And I just couldn't imagine, because in the nursing school I went to, you took care of everybody the same.
What Bonne Terre Hospital did in order to have a male person to be able to catheterize male patients was they trained some of the males that were on the staff, weren't nurses because didn't have male nurses, it was the maintenance department. Good friend of my dad's. He checked into the hospital on a day, and so happens that night, it must have been in the winter or something, that night the heat didn't kick on. The head maintenance man, his name was Ted Tenholder, comes to the door, had a toolkit, tears the thing up. He had grease and parts and stuff all over the place, but he got it back together, turned it on, and it worked. Here's the bad part. He said about 4 hours later, he said there's a knock on the door for a catheter, and there's Ted Tenholder. The same man who had just the night before fixed my heater and had grease all up to his arms and stuff like that, and by golly, he came in and put my catheter in, and he said, I don't know what kind of place you're running over there, he said, but you need to get some nurses over there that can do the catheterization.
In 1957, Bonne Terre Hospital faced one of its biggest challenges. On May 21st, a large tornado struck the area. The hospital had to prepare to treat mass casualties. Its 3 sources of electricity were knocked out, but the community came to help.
I can remember very well families all over Bonne Terre taking down cots, beds, blankets, all sorts of supplies that might have around the house and taking them down there to the hospital. The operating room was set up with Coleman lanterns in order to get through the emergency. For Bonne Terre Hospital, it just showed what a community can do when they pitch in and people help in a real extreme situation like that.
Bonne Terre Hospital celebrated its 50th anniversary in 1961. That year, there were nearly 5,000 admissions and over 700 births at the hospital. By comparison, there were just 197 admissions and 1 birth when the hospital first opened in 1911. In 1963, St. Joseph Lead Company turned the operation of the hospital over entirely to the community and board of directors. With this change, the hospital became independent of the company for the first time. After a massive fund drive conducted by fundraising chairman Paul G. Williams, Jr. and board president Elmer A. Jones, a new addition was opened in 1968. This added an intensive care unit, a new waiting room, and partitions that converted patient rooms into private accommodations. In 1978, another expansion brought much-needed space and parking and increased the capacity of the hospital to 130 beds.
It had all the components of a large hospital, really just in a very small area. So it's a fairly small building, but there was a lot of services.
As the hospital underwent rapid change in the 1960s and 70s, there's one thing that stayed the same: the commitment of the hospital staff to the community.
Everyone got along, everyone helped each other. We all worked together, whatever it was.
In 1980, we had so much snow that it closed the roads. There was 2 RNs in the hospital, and we got a phone call from the fire department that they were bringing to us a pregnant woman who was ready to deliver. We had called a doctor who lived up the street at the time, and he actually walked down the railroad track, walked down the road in the snow, walked in as the baby was being born. I grabbed his coat and he grabbed the baby. So that's just how dedicated they were. I mean, it was a cold, snowy night, and he walked to help us when the cars and trucks and ambulances couldn't get through.
Charles Roberts became the hospital administrator in 1977. He remembers the loyalty and integrity of the employees, as well as the events and social gatherings they held. Some events were even held on the hospital grounds.
The land extended over towards the railroad track. We probably had, I don't know, 50 or 60, 70 trees out in that area, large oak trees, and it was just truly beautiful. We had a young widow working there. She came to me one day and she said, "Mr. Roberts, I would just love to get married on the hospital grounds. It's so beautiful." And I said, "You're more than welcome." She said, I know you're not going to want to do this, but would you give me away? We had a beautiful wedding, and everything just came off just fine. All of the employees were involved, and it was just great.
The 1980s brought significant changes to healthcare. As technology moved forward, the old hospital began to show signs of its age. But further remodeling would be costly, and it wouldn't be easy to do.
The building was so old, but we just could not tear out walls. There was no way. They were all load-bearing, and that was the major problem. We had some walls in that building that were 14 inches thick.
In 1984, Bonne Terre Hospital became affiliated with Christian Health Services Corporation in St. Louis. In 1992, the hospital merged with Farmington Community Hospital to become Parkland Health Center. The following year, Christian Health Services, Barnes Hospital, and Jewish Hospital announced the merger of their operations. The new entity became BJC Health System, now BJC Healthcare. Parkland Health Center conducted an extensive building program in Bonne Terre and Farmington, and on July 21, 1995, opened a new $4 million facility just off of Highway 67. The old building that served as Bonne Terre Hospital from 1911 until 1992 was sold to a developer and renovated. It opened in November of 1999 as a nursing care facility called St. Joe Manor. Still across from Bonne Terre Lake and surrounded by the spacious grounds purchased 100 years ago by St. Joseph Lead Company, St. Joe Manor provides care for senior adults.
The old hospital, of course everybody in the community was afraid would just be an empty eyesore. It's hard to identify the inside of the building, how it's changed so dramatically from a hospital to what it is now. It looks terrific.
Parkland Health Center continues to the present day as part of BJC Healthcare. In recent years, Parkland Health Center has met the needs of the growing community by expanding facilities and services at the Farmington location. In 2010, Parkland Health Center had over 3,800 inpatient visits, 92,000 outpatient visits, plus an additional 35,000 emergency room patients at both locations. Some of the history of the first 100 years of Bonne Terre Hospital can still be seen in the lobby of Parkland Health Center, Bonne Terre.
Several people wanted a way to not lose the history of Bonne Terre Hospital when we moved from the old building to the new, and we commissioned a person from a local community to draw a mural. It goes all the way from the mining company through today, through BJC being a part of what we are today. I think we have a legacy that will go on forever with the mural, and I think as long as we will be able to provide the care that we can, we'll be able to continue that legacy, which is I think what we're all about.